This is very important especially when it comes to the treatment of psychiatric disorders, mobilizing and providing good social support, because by this we can avoid institutionalization as much as possible. So be sensitive to the social challenges the person is facing. With the onset of the psychiatric disorders, if we take either depression or bipolar disorders or schizophrenia, social isolation is the common challenge that we come across for patients with mental illness. So assessing the social challenges, people may experience stigma, people may experience discrimination in the family, people may self-stigmatize that I'm a person with mental illness. These are the social challenges that the person is facing. People may find it difficult, they may lose a job, or they may drop out of the education in which they are living, or they may experience stigma at their workplace. So these are the various social challenges that the persons will face, with especially when it comes to mental disorders. In that case, encourage involvement of self-help groups. Self-help groups in the sense, a group of people who are having a similar illness, they can interact, share each other's problems and the possible solutions for that. Or the caregivers of these persons with mental illness can have a self-help groups. And identifying and mobilizing possible sources of social and community support in the local area, educational, housing, and vocational supports. The likely outcome of the person with mental illness, they will have challenges with, as I said, they will have challenges with respect to education, their employment. So providing support with respect to this becomes very important. There are certain high risk patients like pregnant women or breastfeeding women or old age. So it is important to make frequent follow-ups, especially with a pregnant woman who is taking psychotropics or a woman who is breastfeeding. And if a patient is on psychotropics, the babies of the woman have to be monitored for the side effects and the withdrawal effects of the medications. And other high-risk group population is the old age people. So there also frequent follow-up becomes very important. So it is important to ensure that the patient, they are treated in a holistic manner, meeting the person's mental health needs of a person who is having physical disorders, as well as physical health needs of a person with mental disorders. At last, protection of the human rights. So protecting the human rights of a person with mental illness becomes a very important factor, especially there are chances that the patients with mental illness, they are more likely to be treated in a way in which they don't want, and wherein it hurts their autonomy. So you should know about the country's national legislation. So the national legislation is there to protect the rights of persons with mental illness. In India, we follow the Mental Health Care Act, which has been passed recently in the parliament. So knowing these mental health care acts becomes important, especially when you're treating, especially when you're managing difficult patients, aggressive patients. So it is to protect yourself as well as protect the rights of the persons with mental illness. So whenever we are treating, it is important to promote the patient's autonomy, avoid institutional as much as possible, so that they can have an independent life in the community, unless there is really a requirement for institutionalization, unless the patient is at risk to self or others. So the care should be provided in a way that respects a person's dignity, and no discrimination should be made based on any race, color, sex, language, or any other parameters. Ensure that whenever we are providing healthcare services, it is important to obtain an informed consent from the patient. If the patient is unable to give consent, then from the immediate family members. Consent is generally taken when it comes to child and adolescent population. Consent, we take it from the parents or the guardians, but it does not mean that we should not ask their permission. So consent should be taken even from the children and adolescents in manner inconsistent with their evolving capacities, and they should also be given an opportunity to discuss their concerns in private. It's not that they cannot decide things for themselves. Confidentiality is one more prime issue. So special attention to confidentiality, because the patient is likely, or the family members are likely to provide information which are very sensitive So at no point of time breach in the confidentiality should occur, except when there are conditions like when the patient is risk to self or risk to others, the patient is expressing plans of suicide or persecutory ideas, and then is wanting to kill anyone. So only in those circumstances the breach of confidentiality can occur. The consent of the person, keep the caregivers also informed about the person's health status and the periodic follow-up that is required and monitoring for the side effects. Prevent like the stigma, marginalization. People with mental illness are likely to experience either the stigma in the family context or in the society. They may experience discrimination or marginalization, that they will be treated as if he's an insignificant person. So all these things needs to be taken into consideration and avoid stigma. At last, attention to overall well-being. It's not that we are just addressing the mental condition that is present. The overall well-being should be promoted, in the sense the patient should be advised, encouraged to do physical activity, because they will be taking medications which are likely to cause some metabolic side effects, metabolic syndrome, diabetes. It is important to prevent those to some extent by doing this regular physical activities, monitoring the weight, and also it is important to educate the patients about the risk, like harmful alcohol use, which can again is a risk factor for relapse of symptoms, cessation of tobacco, because patients with, especially with schizophrenia or other mental disorders, are at risk of using tobacco and other substances, and also educating the patients about high risky behaviors like unprotected sexual intercourse. Psychoeducation, such education should be provided. So also it is important for the physician to do periodic health checkups and prepare person for the developmental changes, like there may be transition such as puberty, menopause, and especially and discussing plans. If the patient is on psychotropics, they are planning pregnancy and the contraceptive methods, these things should also be kept in mind. So this is my reference, mental health gap intervention guide for mental, neurological and substance use disorders in non-specialized health settings. Thank you.